PetVivo is a biomedical device company currently focusing on the manufacturing, commercialization, and licensing of innovative medical devices for animals. And with me is the CEO, John Lai, to talk about, let's just give everybody an update on what PetVivo is doing and who are the recipients of this medical device.
So we developed a protein particle matrix that mimics cartilage and tissue. So it's a very effective tool in the management of osteoarthritis, lameness, joint afflictions, and in many situations for rehab of dogs, horses, and then eventually cats.
Okay.
So we're pretty excited about the cat side because Zoetis came out and talked about how they're focusing on educating veterinary doctors on how to diagnose osteoarthritis in cats. Cats are unique creatures. They have their own personality.
Yeah.
And generally when they have a lameness issue, they just sleep more. And everybody thinks, oh, my cat's getting older. But that's not the case. They could have a much more energetic cat if they treat the osteoarthritis.
Interesting. Okay, so let's start with the horses, because you went to the American Association of Equine Practitioners conference.
Yep.
Explain that, and how was the product received there?
Yep. So it's the biggest conference for equine doctors in the United States. It was in San Antonio this year, and next year it will be in San Diego. And it was really refreshing and interesting to see how MWI helped us in the marketing of the product. They sent it to all the equine vets before the conference to come visit us at our booth and also go to our theater presentations where Dr. Joe Manning presented the benefits of Spring with Osteo Cushion technology. Our booth was literally 3 deep most of the time, which was really good because everyone's looking for a naturally derived product, which ours is. There's synthetic lubricants out there. They work well, but the regulators for horse racing and other types of performance horse is starting to put restrictions on the use of that. So we become the de facto alternative.
That's interesting.
Yeah, and at the theater presentation, I think capacity was like 100. We had like 115 to 120, 2 straight days of Dr. Manning presenting, which is really big. So
Now that MWI partnership you just reached last year, right? Or
no, actually, well, I guess we're into the new year, but
okay.
Yeah, it was, we completed it June of 2020. No, 2022, I'm sorry. I keep forgetting. And
it's
now,
all a blur.
I know. And we started shipping right at the end of September through the MWI reps, and they're doing a really good job. We're really happy with the partnership. I think they're pretty happy. The sell-through's been really good. So we feel that partnership will continue to grow.
Yeah, that seems like a real game changer for the company.
Yeah, they're the largest player in the veterinary space of distribution of products, veterinary products. They do about $5 billion a year, just in the United States, so that's quite large. And they recently did acquisitions in Europe and the Middle East to make them the #1 players in those countries. So I see that as a natural progression of expanding into those countries.
Okay.
Yeah.
Now, there is a clinical trial that you've been conducting on dogs, right? That you expect the results fairly soon?
Yeah, it's with Ethos. We completed the study, and technically it's a study because it's not for the FDA. It's for marketing because we don't have to do any FDA work because our product is classified as a veterinary medical device, so we follow along the exemptions. So we've got a whole series of studies that over the next 6 months will be getting presented at various conferences. And this one will be presented at a very prominent conference 3rd week of February. We feel it will be really good for them to allow the clinician from Ethos to present. I think they kind of know what the data is. We don't get to see this data, obviously, but they do to allow that to get published in the journals and so on.
Yeah, and this would be the osteoarthritis treatment for dogs as well.
Yeah, it's specifically, I think this one is doing with hips because we have studies for each, like elbows with Colorado State. We chose to go that route because it gives relevant marketing data to help the MWI reps introduce the product and point specifically to the small animal vets. Right now, 90% or north of 90% of our sales are in the equine space because the equine market, the adoption is much quicker.
I see.
The vets see the animals perform right away, you know, like a rodeo horse or a race horse. Okay. They see it, so right away they're comfortable on treating other horses.
Yeah.
With the small animals, it takes much longer because the dog goes home and they may not see it for 6 months to a year, and then they're really impressed by the results we're getting. So from a anecdotal real-world case, we're getting a lot of good reviews from the veterinary doctors that are treating the dogs or providing spring to the dogs and getting real good responses. We actually have some vets on every dog they see. He writes in, this is something you should consider at the first sign of any type of lameness issue, is our spring with osteocushion.
Well, and it sounds like this year will be a pivotal issue for expanding to the dogs.
Yes, the dogs and then the cat study
cats.
should be between 6 and 9 months. We should have that completed where we can start marketing through MWI.
Okay. Now you're listed here on the NASDAQ, PETV for symbol, but you've also chosen a dual listing on Upstream. So explain what Upstream is and why is that beneficial?
Sure. So Upstream allows us to be a global issuer. Upstream is unique in the sense that a foreign individual doesn't have to go through a whole series of paperwork to own U.S. stocks. It's very difficult for the small individual. So we're providing a financial intermediary that allows people in China, people in Russia, people in Eastern Europe to be able to buy our stock by downloading the Upstream app onto their phone. And it's the only system out there that allows you to settle in crypto. So it's based off the U.S. stable dollar. So everything is held there, and it's gone through a U.S. bank. So the money is actually FDIC insured. I don't know how they were able to get that, but that was quite impressive. So to me, it was a situation where we feel we have a very compelling story, and the average individual out there, if they like what we're doing and helping animals, improve the quality of life of the animals, also improve the quality of life for the owner to be able to enjoy their animals, I think they may want to be part of it. And now they have the access to be able to buy 10 shares, 100 shares, whatever, without going through all the regulatory nightmare of the paperwork, as well as the regulatory costs, because like people in Canada, other countries try to buy our stock, they got to set up a custodian account. It's very expensive.
I see.
Yeah, and here you're able to just buy it, and it's held at the transfer agent, so the shares are safe. You're not dealing with FTX type exchange situation.
Right. Yeah. Yeah. No. The financial industry is very, very regulated. So
this
is a surprise, and especially if you're looking at global expansion in the Middle East. This exposes the product to people who are interested in buying shares. So.
Yeah, and this exchange has very good financial backing behind it. They're part of the ITS ATS system. That means they can execute on every exchange in the world.
Oh, interesting. Okay, so it sounds like you've got a busy year ahead.
Yes, it is.
Going on?
Oh, also the exchange is open for 20 hours.
Okay. So 24/7 anymore, it feels like. Well, I look forward to our updates this year as all these kind of pivotal things come through, the clinical trials and so forth. So.
Yep, great. Thank you, Jane.
Thanks, John.